Balloons are not just for parties. They actually can be used to get your patient out of pain, improve their flexibility, and help them perform better. So that's why in this video, I want to show you my 4 ways that I like to incorporate a balloon to enhance my patient's session. Most of our patients have weak abs because they're in a position that is causing them to be weak. For example, when you have a patient that has an extended spine, a flared rib cage, and a wide infrasternal angle, then they really don't have a chance to be strong. The position that the rib cage is in creates eccentric or a lengthened position of the abs, aka a weakened state. So in order to truly strengthen abdominals, we first need to be in a position to do so. That's where the balloon comes in. A balloon is a dumbbell for your abs. It's just going to provide resistance. So once we are blowing up the balloon, as we exhale, the ribs are going to come down and in. This down and in is going to actually put the abs in a position where they can gain leverage to build strength. How many of you are working with patients with tight necks and tight upper traps? Super common, right? Well, the nice thing when you start to use balloons and you do it in the right manner, every exhale is going to stretch the neck muscles. Why? Because as you take a good exhale, the rib cage is going to come down. As you continue to take more and more breaths, it's going to get lower and lower. So if you think about this band representing the SCM, as you exhale, it's going to continue to go lower. This is a great way to give someone with neck pain a ton of relief without actually sitting there and stretching. Even on the performance side, when you're first teaching an exercise, you can use a balloon to really help bias a better position. For example, a deadlift. Ideally, with a deadlift, we're not going into it with this crazy extended posture. So to really help your patient feel the rib cage go down and in, you can deadlift with a balloon. I know it sounds crazy and looks silly, but it's going to get them in a better position and help them maintain that throughout the lift. It would look as follows. Breathing is one of the easiest ways I use to improve patients' mobility. For example, if a patient has limited right shoulder internal rotation, what that's telling you is that they don't have the space to move into internal rotation, aka they're too compressed here. We can use a balloon and a position to help improve that space here. All we do is a left side bend that creates compression here, expansion here. Then all we do is breathe into the balloon. As we inhale, we should see this side move more. So I hope you now have a redefined thought process as to the benefits of using this during your sessions. If you want to learn more and dive deeper on continuing to learn how to enhance your sessions to get your patient better results and to get them out of pain, then I would encourage you to check out our Performance Redefined course. This is our online self-paced course where we dive deep into coaching movements so you can maximize your patient's results. I will leave the link in the description below, and I will see you guys on the next video.